Hey guys, this is Jay Patel from MyFitMed. Today we'll talk about Cialis, the generic name Tadalafil. Cialis is PDE5 inhibitor like Viagra, which is commonly used for ED in men. We get a lot of questions from patients, how is Cialis different than Viagra? So the main difference between Cialis and Viagra is the half-life. Cialis has a longer half-life, which means it stays in your system for longer time than Viagra. So the effect of Cialis lasts longer, almost for 24 hours in your system. Unlike Viagra, which has to be taken right before having sex, Cialis can be taken once a day, same time every day, and the effect will last for 24 hours. So it helps you with more spontaneous sex, unlike Viagra. That's the main difference between Cialis and Viagra. Cialis in a low dose can improve your blood pressure. It is FDA approved for treating pulmonary hypertension. So Cialis basically improves your blood flow and helps you drop the blood pressure. Low dose Cialis is also FDA approved for treating BPH. BPH is benign prostatic hyperplasia, which means enlargement of prostate, which gives you a lot of urinary symptoms. Cialis in a low dose can improve the symptoms of BPH and overall improves your prostate health. Low dose Cialis is also used off-label to treat symptoms of Raynaud syndrome. Raynaud syndrome is caused by constriction of small arteries. So constriction of small artery in extremities can lead to poor blood flow in fingers and toes, causing the fingers and toe to feel numb all the time and feel cold all the time. So low dose Cialis helps you improve the symptoms of Raynaud syndrome. So these are the benefits of Cialis other than commonly known benefit of improving your ED. If you have more questions, call us, subscribe for more videos, and give us a thumbs up.